Welcome to today's episode of the Skin of Color Savvy, the art and science of treating patients of color, the official podcast of the Skin of Color Society, produced by HCP Live. Hosted by SOCS leaders, Skin of Color Savvy delves into the latest research, clinical insights, culturally intelligent and responsive practices, and news in treating patients of color. Today's episode features Dr. Corey Hartman, who is one of 8 outstanding experts presenting at the recent SOCS Virtual Media Day titled Trends and Truths in Skin of Color, Setting the Record Straight in the Age of Misinformation. We're looking forward to hearing about it. But first, Dr. Hartman, please introduce yourself and tell us a little bit about your practice and some of your clinical interests.
Hi, I'm Corey Hartman, a board certified dermatologist practicing in Birmingham, Alabama, at a practice I founded called Skin Wellness Dermatology, and I'm also an adjunct associate professor in the Department of Dermatology at the UAB Hearsing School of Medicine.
And as one of the experts presenting at this informative event, I know you spoke about the importance of sunscreen use in melanin-rich skin. So please share your thoughts with us about areas where more education might be needed to clear up prevailing myths, misconceptions, controversies surrounding the need for sunscreen and skin color.
Yeah, so patients that have more melanin in their skin, patients with brown skin tones, darker skin tones, often think that they don't need sunscreen at all. And while darker skin is less likely to develop burning as a result of UV exposure, there is still a risk of burning. Melanin can protect you from the sun damage that lighter skin patients will see, but it's not full protection. So we have about an SPF inherently of 8 to 13, but we know that the recommended range for full protection from skin cancer, premature aging, discoloration is really in the range of 30 to 50. So we still encourage all patients, even those with darker skin tones, to apply sunscreen every day so that they don't have to worry about that sun damage that can lead to skin cancer and premature aging, which is a concern for many more patients than skin cancer alone. 100% effective skin, like no skin tone is going to be 100% effective as far as warding off the sun, but there is an inherent sun protection factor with darker skin tones that can sometimes lead them to think that they don't need sunscreen at all.
Absolutely. And are you informing them when you're talking to patients? How in general do you encourage them to use sunscreen? And is there a kind of a conversation that happens in this area?
Yeah, patients that come in to my office are not necessarily concerned as much about developing skin cancer, although we still diagnose non-melanoma skin cancers in brown and black patients, 4 or 5 a year. So that's always a part of the conversation. But when they come in, they're usually worried about discoloration as a result of melasma or post-inflammatory hyperpigmentation that can come after acne, seborrheic dermatitis, eczema, rosacea, you name it. And so as part of that education on how to treat those disorders effectively and treat the corresponding hyperpigmentation, we take that opportunity to educate them about the importance of sun protection.
Great, thank you for sharing that. And then you were paired with Dr. Rebecca Vasquez, who spoke about skin cancer in Skin of Color. So, what are the big takeaways about this particular topic?
Well, I think that the big thing about skin cancer in darker skin tones is that it can happen, number one, and that these patients just aren't as accustomed to using sunscreen from a very early age. They have limited awareness about the prevalence of skin cancer in their population. They don't come in as regularly for skin checks, and they just have less representation when it comes to what the diagnosis actually looks like on their skin, which can lead even dermatologists sometimes to miss the diagnosis. So education about being really informed about changes in the skin is important so that they can look for things on their own and bring it to the dermatologist's attention. Maybe just educating them about the fact that a good eye on their skin once a year is not a bad idea, even if they don't have the same skin cancer risk. And then just, making sure they understand that new things and that change on their skin need to be evaluated.
Okay, thank you for sharing that. And then I wanted to ask you as well, following the overarching theme of the SOCS Media Day program to set the record straight in the age of misinformation, there was also a timely talk about what's trending on social media. So it was covering sort of what's hot, what's not, and it was addressed by Dr. Brittany Oliver and Dr. Deval Bonasali. And before we get into the trends themselves, could you give us your take on what's sort of happening in the social media landscape when it comes to skincare?
Yeah, social media is like the wild, wild west. You have experts who are not really experts, who have no credentials, who have large followings, who are out there sharing all kinds of information, which is why a lot of dermatologists feel as though, even though it's not always convenient or fun, we have to fill that void to make sure that at least the good information is out there for the taking. Some of the information that's out there is credible. You have, other skincare scientists, cosmetic formulators, founders of brands who do bring good quality, education and material out there. But there, just for every one of those, I feel like there are 10 people who don't have the credentials, don't really have the level of education that's required to speak on these things with nuance, or they're selling things, and it can be hard for the general public to discern the difference between all these people with platforms. Really, I hate to use any other word, but people with platforms, because that's really all that they are. So it's a lot of misinformation. We need a group of dedicated physicians who have the education and the knowledge and the clinical expertise to address these things head on, to get the word out to the public about what's really going on in the age of misinformation. Otherwise, we can see a lot of complications from products or devices that are used at home that are not always the safest options.
What do you feel are some of those big concerns in, let's say, the derm space with regard to misinformation? I mean, have you noticed an alarming uptick in, patients coming in with kind of misinformed ideas about what they should be using, or what has been sort of your experience there?
Yeah, it happens every day. There are things that trend on TikTok that become huge that don't have a lot of science behind them. For example, beef tallow. This went viral in 2025 as a natural alternative to conventional moisturizers. And we don't recommend this because beef tallow is just beef fat that's used for cooking. It can be incorporated into other products like soaps and candles, but it's not really meant to be used on the skin as a moisturizer. This is it's important because patients are looking for natural alternatives, but natural doesn't mean risk-free. I like to use the example that poison ivy is natural, but it's certainly not something that you want to expose your skin to. And if your skin is oily or you have acne, when you put beef tallow, which is just another animal fat on your skin, you're going to increase your risk of having breakouts, which can lead to inflammation, discoloration, scarring, and all the rest. Not to mention the fact that, this is an animal product. It's not regulated. It could go bad. It could cause reactions. And there's just so many other good active ingredients in moisturizers these days that we don't really have to go looking for crude products like beef tallow when we have ceramides and petrolatum and glycerin and squalane and so many other good active ingredients.
And I know that skincare and makeup have become hobbies for, adolescents and even younger kids sometimes, unfortunately, or fortunately, depending on, I guess, your view on it. But among the popular trends on social media, you've got multi-step routines, glass skin, skincare smoothies. So is that a topic that you think is worth kind of discussing?
Yeah, the whole teen tween skincare thing. It's good that kids are thinking more about skincare, but I do think that the pendulum is sort of swung too far in the other direction, where you have 12 and 13-year-olds using anti-aging products that they obviously do not need. And a lot of these ingredients can be irritating to the skin, which can then exacerbate problems that they're already dealing with, like eczema, or making them have new issues that they hadn't otherwise developed, like acne. So not only is there the problem of them using active ingredients that are not necessarily appropriate for their skin or their condition, but when you start mixing these things, that's always an issue. It's why we encourage patients to start new products slowly, one at a time. Of course, there's always going to be irritation that goes along with that. Their skin is not fully developed. So the things that an adult skin would be able to handle, a child's skin may not be able to. I'm always shocked that these parents are going to these expensive stores like Sephora and spending 60 to $80 per product on these products. That to me should have been the barrier to use, but it's not always the case. But I know that there's a lot of peer pressure for these kids to get into this. And, it becomes a hobby for them. There's a lot of social media directed toward them, a lot of marketing. Some of it has just gotten really ridiculous. I think that the latest thing is about a skincare line, including masks for toddlers.
Do you feel like there's adequate concern among younger people with regard to sunscreen and skincare in that sense, or do you feel like it's more of a focus on, skincare products, like you said, that are anti-aging or whatever it may be?
Yeah, if the focus was on good, sound skincare practices, that'll be one thing, but that's really not what we're seeing. We're seeing it tip more into what I talked about before, use of inappropriate active ingredients. If we could keep it simple with drugstore brands, that's what we would all prefer.
Great. So as patient interest and awareness are kind of on the rise, what would you like colleagues in other specialties to better understand about the dermatologist's perspective on the health and well-being of the whole patient?
Everything is connected. We now understand how the skin plays a role in GLP-1 treatment, which a lot of patients are on. We're talking about regenerative medicine and how it all ties together. There's have been some improvements in that area, but there's a lot of research to do.
Thank you for sharing that. Yeah, and I also wanted to ask you about the topic of exosomes, which I know was a topic that was kind of touched upon during the conference. So could you talk to us a little bit about that?
Exosomes are a topic that we hear a lot about. Exosomes are particles that facilitate cell-to-cell communication and give a pathway for skin cells to talk to each other a little bit better. So I think there's a lot there, but a lot of it has not been elucidated. And again, it's a wild, wild west with every product, every company running to market with a product that has claims that have not necessarily been found to be scientifically sound. So I look forward to the day when we know more information about regenerative medicine, exosomes, PDRN, and all the other wonderful things that are out there right now, but just need to be reined in a little bit more.
Okay, well, I'd like to close out then the podcast right now with your favorite pearl of wisdom to inspire your medical colleagues. So please share an insight that's been meaningful to you in your journey as a physician.
I own a business. People often ask about how to run your own practice. I think you stay true to yourself. You negotiate for yourself. You don't let anybody take advantage of you. That's probably the biggest piece of advice that I could give to somebody in the medical field, and to stay on top of as many things as you can in your particular niche. Find a category that you like in dermatology and stick with that.
All right, well, Dr. Hartman, thanks so much for sharing that with us, and thanks in general for the discussion today. And to our listeners, we hope you found today's episode enlightening. And if you're interested in learning more about the work of the Skin of Color Society, please visit skinofcolorsociety.org. And we'll be back soon with another episode, so be sure to subscribe to Skin of Color Savvy on your favorite podcast platform. And until next time, take care, and thank you for listening.